Let's talk more about this now with Fabrizio Carboni. He is the Near and Middle East Regional Director at the International Committee of the Red Cross and joins me live from Geneva. Thank you for joining us on the program.
Thank you.
As I mentioned, Yemen recorded its first 2 deaths just today from coronavirus. But how do we even know what the real numbers are in these war-torn countries, the number of people who are with infections and the number of people who have died from coronavirus when people don't even have hospitals to go to?
No, I think we don't, and we need to accept that we will have to work and deal with this epidemic with a high level of uncertainty. What we know is that the coronavirus in a place like Yemen, but it's applicable to Syria, to Iraq, it's not just a health problem. It's also a socio-economic problem. I think your program on Yemen is just perfect. It's explained exactly the issue. To stay home is a luxury. It's a luxury, and it's adapted for probably advanced country, developed country, but for those countries who've been affected by violence and conflict, I mean, to stay home is a luxury for the reason mentioned in your program. If you don't go out, you have no money. If you have no money, you have no food to feed your family. So you have to choose between maybe dying of COVID or for sure dying of hunger.
Let's look at Syria, where there are millions of people just internally displaced in the country, people living in refugee camps. Even before the pandemic, it was virtually impossible for them to get clean food and water. They're living in unsanitary conditions. How do people in these situations protect themselves from the coronavirus? How do they socially distance? How do they, have access to masks when they can't even get basic supplies?
No, I think, we don't even have to speak about this very vulnerable category of people. You talking about mask protective equipment, I believe it's in short supply around the world. We finally managed to bring in Iraq and in Syria, in Yemen, protective equipment for frontline responder, and mainly the national societies, the Red Crescent, the Yemeni Red Crescent, the Syria Red Crescent. But we only managed to do it 2 months later because we are in competition with states. We are in competition with states who are ready to pay 2 times, 3 times the prices of protective equipment. So the competition is unfair, and who pays the price? It's obviously the most vulnerable people. First, the volunteers of the Red Cross and Red Crescent movement, who are first responder, and the people displaced because of conflict, and also people in places of detention. So we're doing our best to prevent the virus to spread into this vulnerable community, providing them with water, with food, trying to ease the pressure on overcrowding. But it needs to be clear, the solution proposed today to limit the impact of the COVID, it's a luxury.
What about the international community? What, if anything, can the international community do to help? Because, of course, in the United States, they're dealing with the pandemic there as well. But can other countries still step up to help? And again, how do these, this aid get to these people when they can't even get basic supplies?
I think first it needs to be very clear that we will be safe if we are all safe. We are together in this. It's an illusion to believe that we can isolate ourselves from the rest of the world. So level of solidarity. The day we have vaccines will be for everybody. The day we have treatment, the treatment should be for everybody. And the second message is that the COVID crisis in places of conflict, it's not only a health issue. It's also a socio-economic issue. And today we need to not divert from the humanitarian aid into only the medical aid. We need the full package of support. And the most important, it's also tomorrow. Tomorrow, those society will have to get back on their feet. And they will need long-term support to kickstart the economy, to make sure that the health system recover from this situation. So long-term attention, not only on health, but on all the aspects of a socioeconomic support package.
All right, and we'll leave it there. Thank you so much for your time, Fabrizio Carboni, joining us from Geneva.